According to a new announcement from the World Health Organization, a vaccine, even if we get one, will not be the end of all of this. It will never end. You can get your injection, they'll make you get it, but you'll still be under arrest. The World Health Organization says that finding a vaccine is not the goal. Reordering society is the goal. Quote, we cannot go back to the way things were. That's a direct quote from the leader of the World Health Organization, Dr. Tedros, who, by the way, is not really a doctor. Because COVID-19 is not a public health crisis, really, or even a mere virus. According to Tedros, COVID-19 is, in fact, and this may surprise you, COVID-19 is really about global warming. As he puts it, quote, the COVID-19 pandemic has given new impetus to the need to accelerate efforts to respond to climate change. I bet you didn't see that coming. For Dr. Tedros and Bill Gates, pandemic and climate change share a very different connection. Both are useful pretexts for mass social control. Both are essentially unsolvable crises they can harness to bypass democracy and force powerless populations to obey their commands. Now it makes sense. Ever wondered why our leaders consider the coronavirus a major public health crisis, but not, say, suicides and drug ODs? Well, this is why. Here's another data point for you that you won't see on television. Less than a month ago, on July 31st, the CDC, Centers for Disease Control in Atlanta, our primary public health organization, funded by the federal government, released guidelines to state health departments about patients infected with the coronavirus. How do you track the spread of this disease? In a footnote in the release, the CDC acknowledged that researchers lack evidence that, quote, masks offer any protection against coronavirus, any, at all. As health officials work to track the spread of the virus, the CDC suggested that they ignore whether or not people were wearing masks. In other words, wearing a mask may be completely irrelevant to the spread of the virus.